Oral questions. I recognize the Leader of the Opposition.
Thank you, Mr. Speaker. Last week, Lana Fiddler's 9-year-old daughter, Brielle, was rushed to St. Paul's Hospital in severe pain. Even though a doctor said that urgent surgery was required to remove Brielle's appendix, there was no pediatric surgeon available in Saskatoon to help her. The doctor told Lana that they would have to send Brielle the next day to Regina. Understandably, Lana is very upset about the treatment that her daughter received. She said this, quote, "Is our healthcare system seriously that poor that we didn't have any doctor here that could help her? What happens when the next kid needs something? It's quite sad," end quote. To the Premier, how is it possible that there was not a doctor available in Saskatoon to help Brielle?
Total Crown Corporation debt has already increased 94% under that government. After this year, according to the government's own budget documents, Crown debt will have increased by 106% under its watch. That means that in 7 years under this government, our Crowns will have racked up over $4 billion in new debt, and there's no end in sight. Now this government is increasing the debt limit for the global transportation hub by 650%.
Here's what we know. The Minister of Social Services went to Ghana and London and billed taxpayers inappropriately for those expenses. The Minister took her friend along for that trip. They had a $200 personal lunch at taxpayers' expense, which was only repaid once the opposition exposed that expense. The Minister and the friend were chauffeured around London, Mr. Speaker, in a Mercedes for $3,600 a day, which was only repaid once it was exposed by the opposition. The Social Services Minister then appoints that very same friend as co-chair of the Social Services Appeal Board, which is supposed to be an independent tribunal. Right. And the Social Services Minister and her friend have had at least one lengthy conversation about board-related issues. So again, Mr. Speaker, my question to the Premier, how does this not count as reasonable apprehension of bias?
Hear, hear. As of May 1st, there were at least 12 Community Living Service Division clients living in hospitals for extended periods of time because this government has nowhere else for them to go. These are individuals with intellectual disabilities. They deserve to live in a home, not to be warehoused in hospitals for years at a time. To the Minister, how can she possibly justify this? If this government can't figure out what to do with these CLSD clients who have been stuck in hospitals for years, how is it possibly prepared to meet the needs of the residents of the Valley View Centre when it closes its doors? To the Minister, what is the answer?
The Executive Director of the School of Public Health at the University of Saskatchewan is speaking out because he and many of his colleagues throughout the university have major concerns with what is happening at the U of S. He says, quote, "Major changes with long-term ramifications have been planned behind closed doors, with little or no opportunity for faculty or students to respond. The major recommendations have been released in May, when some of our faculty and most of our students are not even on campus," end quote. Again, this is incredibly concerning to me, and it ought to be of major concern to the Premier. And I agree with Dr. Buckingham that it's important for political leaders to be asking probing questions and to ensure that due process is followed. So again, my question to the Premier, is he concerned, and will he start asking probing questions that demand to be asked?
Hear, hear. Hear, hear.
Mr. Speaker, the School of Public Health at the U of S is an incredible success story. In 5 years, its enrollment has gone from 17 students to 238. It has the largest international student body of a School of Public Health in Canada, and in January of this year, it became the first School of Public Health in North America to receive international accreditation for its master's program. But Dr. Buckingham says, quote, "Much of what has been built over the last 5 years is threatened by the Transform Us plan to place the School of Public Health under the College of Medicine," coming from the Executive Director who has built the school with his colleagues over the last 5 years and who is an expert on its accreditation. This is hugely concerning to me. My question to the Premier, is it a concern for him?
Hear, hear.
The Minister can go on and on if he wants, but the question was whether or not this government thinks it's acceptable that academics would be told to shut up and to not speak to the public or to government. So it's baffling why it refuses to express any sort of concern with what is happening at the University of Saskatchewan, especially when well-respected academics like Dr. Eric Howe, like Dr. Jim Miller, and now Dr. Robert Buckingham are raising major concerns. And now we have confirmation, Mr. Speaker, that debate is being stifled and academics are being told to shut up and to not raise concerns. My question for the Premier, what will it take What will it take for this Premier to express concern about what is going on at the University of Saskatchewan?
Over 1 million people per year visit the beautiful 64-kilometre Meewasin Trail system in Saskatoon. This is an incredibly valuable urban park. The CEO of the MVA, Lloyd Isaac, has expressed concerns that the MVA's mandate, which is a provincial legislative mandate to conserve and protect the natural environment in the heart of Saskatoon, is stymied by this government's refusal to step up to the plate. To the Minister, why has this government flatlined funding for the Meewasin Valley Authority for the last 4 years?
Dr. Robert Buckingham raised very serious concerns yesterday about the implications of Transform Us for the University of Saskatchewan, particularly with respect to the School of Public Health, the school that he played a major role in building. This morning, Mr. Speaker, Dr. Buckingham was called into an office, was fired, was escorted off the campus by police, and was told that he was banned from the University of Saskatchewan forever. It's absolutely unacceptable and it's absolutely appalling. My question, Mr. Speaker, to the Premier, does he share this view, and when will he finally start asking some tough questions about what is happening at the University of Saskatchewan?
Hear, hear. Unbelievable.
Mr. Speaker, the question was whether or not the Premier thinks that it's acceptable that Dr. Buckingham was fired. And then he starts talking about the details of his contract. The fact is, Dr. Buckingham was called into an office, was there with police, was fired and escorted off campus. And that's the answer that we get from the Premier of the province. This Premier and this government doesn't know what's going on, Mr. Speaker, because they have refused, absolutely refused, to ask the tough questions over the past months. They should have been asking questions when respected academics were coming forward. When the USSU had a motion of non-confidence in the Transform Us process, they should have been asking the right questions a long time ago, like whether or not deans and executive directors are being silenced. They should have been asking whether or not open debate is actually being encouraged on campus. They should have been asking whether or not due process is being followed. And they should have been asking whether or not academic freedom is being protected and is enshrined at the University of Saskatchewan. Mr. Speaker, this Premier continues to ignore the concerns that are heard from campus, and we see it by their lackluster response here today and the approach that they're taking. I asked the Premier, Mr. Speaker, whether or not he thinks it's appropriate that Dr. Buckingham was fired. I don't think it's appropriate. He refused to answer. I asked the Premier, Mr. Speaker, whether or not he thinks academic freedom is important on campus, and whether the violation of academic freedom is something to be concerned about. No concern coming from the Premier on that file. I asked the Premier if he's listening to student leaders about whether or not the university is going in the wrong direction. No comment on that, Mr. Speaker. Successive university presidents and leaders in this province have built up the University of Saskatchewan to the proud institution that it is. And when we have a decision, Mr. Speaker, that fires an executive director, that calls into question academic freedom for administrators and all academics on campus, when the campus community is in an uproar and concerned about this, all this government does is fires off a letter, makes no statement on whether or not it's appropriate to fire someone, no statement whether or not academic freedom is sacrosanct. My question to the Premier, when will he pull his head out of the sand and start to take this seriously?
Hear, hear.
Laura Cohn has joined us today. She has endometriosis, a painful condition in which tissue that normally lines the inside of the uterus grows outside of the uterus and then ends up becoming attached to other organs. For Laura, the pain has been constant and debilitating. She has had 4 surgeries. The last time was emergency surgery because her internal organs were shutting down. At the recommendation of her specialist from Saskatoon and another specialist in Alberta, Laura has booked herself for a different kind of surgery in June in Atlanta. With this surgery, she has less than a 5% chance of any reoccurrence of endometriosis. But this government has denied the application for out-of-country coverage. To the Minister, why?
Thank you, Mr. Speaker. The Children's Advocate released a special report today on the tragic death of a child in the care of social services. His first recommendation is that the government develop and implement well-resourced early childhood development and poverty reduction strategies. And we've been calling on this government to take action when it comes to a comprehensive poverty reduction strategy. This is now the second time in a week that the Children's Advocate has formally called for this. To the Minister, will she finally stop with the excuses and finally listen?
Hear, hear, hear.
Speaker, the government took notice of a question on Tuesday about whether or not it believes an independent investigation is warranted into the actions of the member for Saskatoon Sutherland who asked the food bank to pay him to campaign for the Sask Party. To the Premier, what's the answer?
Yesterday I came to question period with a lot of concern and a lot of outrage over what is happening at the University of Saskatchewan. And the Premier, Mr. Speaker, came to question period ill-informed and unprepared to answer the questions about what was going on about the fired professor. Well, here's what Janice McKinnon has to say about what's happening at the U of S. Quote, I think it's a huge issue for academic freedom, and it's actually stunning. A very, very serious situation at the university, end quote. And Janice McKinnon goes on to say, quote, I would say that we are mainly stunned on campus, but there's a lot of anger as well, end quote. My question, Mr. Speaker, to the Premier, has he finally been briefed on this issue properly, and is he now concerned with what is happening at the University of Saskatchewan?
Hear, hear.
Mr. Speaker, yesterday when the Premier was answering questions about this or giving responses about this, he did not take academic freedom seriously one little bit, Mr. Speaker. And today he continues to sit in his seat and not be willing to stand up and speak out about what is going on at the University of Saskatchewan. This government, Mr. Speaker, did not hesitate to condemn and to stand up and to speak out when things were going on at First Nations University of Canada. So it's beyond baffling, Mr. Speaker, why the Premier would pass the baton over to the Advanced Education Minister and sit in his chair and be unwilling to stand up and say what is happening at the university is not correct. My question, Mr. Speaker, to the Premier, will he stand in this Assembly and say the firing of Dr. Buckingham was inappropriate? Yes or no?
Hear, hear.
In recent weeks, we've raised significant concerns about how the poor judgment of the Social Services Minister is compromising the independence of the Social Services Appeals Board. The Premier has refused to act. In fact, he's doubled down on this. To the Premier, will he finally do the right thing? Restore the confidence in the true independence of the Social Services Appeal Board.
Hear, hear.
Mr. Speaker, I don't know if the Premier is a bit tired today or exactly what's going on, but the question was to the Premier. The government has refused to release the expenses for the Premier's right-hand advisor. We know of at least 2 inappropriate expenses claimed on behalf of the ministers by that individual, the Cabinet Secretary. So we need to see the other expense claims. My question to the Premier, why won't he simply put that information on the table today? What's he afraid of? Mr. Speaker, throughout the session, this government has also refused to release a lot of information as it relates to its Lean Pet project, including the breakdown of costs throughout government, the total cost of on-site Japan Kanban seminars, the total cost paid to Japanese seminars and to interpreters and so on. And while we know a fair amount about the Lean Initiative clawback now that's being foisted onto school divisions, this government's been very quiet about the Lean pay bump it's giving to senior health care administrators. I understand this Lean pay bump is given to health care administrators simply for holding more Lean events. I suspect, like the paper airplane folding seminars that frontline health care workers have been forced to attend. To the Premier, how much are taxpayers paying in total to give this Lean pay bump to health care administrators simply to hold more Lean events?
Well, in this case, Mr. Speaker, Sask Party Innovation is giving a pay bump to health administrators for simply holding Lean events. Lean events, Mr. Speaker, where they watch a video where the Premier's on it, praising the benefits of Lean that the healthcare workers have to sit through, where they learn how to fold paper airplanes, Mr. Speaker, and where they learn important words like muda, chaku chaku, kaikaku, haijunka, and so on, Mr. Speaker. All the senior healthcare administrators have to do to get their Lean pay bump is to hold more Lean training events. Mr. Speaker, my question to the Premier, how on earth does it make sense to give performance bonuses to senior health administrators simply for holding Lean events and giving them this Lean pay bump? Mr. Speaker, throughout this sitting, we have seen this government continually neglect the basics. All at the same time, Mr. Speaker, as they have been obsessively focused on their pet projects, and Lean is the best example. Now we have the Lean pay bump, Mr. Speaker, where senior administrators receive additional dollars simply for holding training events where participants learn Japanese words and learn how to fold paper airplanes. It's absolutely ridiculous. All at the same time as the government's very own data through the Health Quality Council shows that adverse events are up, mortality rates for major surgery are up, the infection rates are up, and overall patient satisfaction is down. My question to the Premier, Mr. Speaker, how much is the province paying for the Lean pay bump?
Hear, hear.
I recognize the Premier.